in Kumasi, Ghana. Also, there's a branch in Accra. So the work I'm going to present to you is titled Mental Health, Quality of Life, and Life Experiences of Ghanaian Women Living with Breast Cancer, which was the research that I did as part of my Master's of Science in Global Health at McMaster University. So to start, brief overview, my research question was, are Ghanaian women living with breast cancer more susceptible to psychological distress than their healthy counterparts, and do they have a lower quality of life? Also, how do their lived experiences affect their mental health? So to answer this question, it was a cross-sectional study where I had 64 controls, so 64 healthy women and 64 breast cancer patients answer the Kessler Psychological Distress Scale and the WHO Quality of Life graph. And then among the breast cancer patients, I interviewed 13 women to really assess their lived experiences. So for my results, compared to healthy women, breast cancer patients scored lower for physical health, their environment, psychological well-being, and they also scored lower for overall satisfaction with health and quality of life. So they felt less energy. They felt that physical pain prevented them from doing what they needed to do, and they weren't as satisfied with their capacity for work. They also had less opportunities for leisure activities. They felt that they did not have enough money, and they felt significantly less safe in their daily lives. They felt also that their life was not as meaningful. They had more negative feelings, and they had difficulty accepting their bodily appearance. And also, compared to healthy women, breast cancer patients scored higher for psychological distress. So another thing that I realized and understood from interviewing these breast cancer patients is that there was kind of a temporality of psychological distress. They kind of went through the same journey, which started with breast cancer knowledge and suspicion. So one of the first signs for them of where they became suspicious of maybe having ill health was pain and breast lump. One thing that was interesting but not surprising was that most women had varying degrees of breast cancer knowledge. So you had those who had family members who had breast cancer who came almost immediately, and then you had those who had never heard of breast cancer until they were actually diagnosed. Navigating the healthcare system. So this is a quote. Actually, when I detected the lump in my breast, I didn't know where to go. So this is also a very serious issue and a common trend as well. Women going through multiple care nodes before actually getting the breast cancer treatment that they need. The impact of breast cancer. So it affected their female identity, the roles and responsibilities as mothers, as sisters, as church members, as workers in general. They also had difficulty accessing treatment. That was very common. Most cancer treatment centers in Ghana are located in the south. They're located in Kumasi mainly, and basically Kumasi and Accra, and there's one hospital as well, the teaching hospital in Tamale, which is in the north. So a lot of these women are traveling from very far to be able to get treatment, which is a physical burden as well as a financial burden. In terms of physical health consequences, they had inability to eat, mood swings, loss of substantial amount of weight, and pains. But one thing that was definitely interesting, especially for women who were further along their breast cancer journey, is that there was this kind of sense of regaining of confidence. So I'm glad I am better as compared to when I started treatment. She goes on to say that I see the difference now, and she was very, very happy, and there was a lot of women who were near the ending of their journey that felt the same sentiment. So for a lot of the women, they were receiving at least one type of support, whether it was emotional, financial, or physical. And coping mechanisms, the most common one was religion. Being able to go to church, being able to take some time to read their Bible is one of the main mechanisms most women had. Interestingly, and also great to know, was that a lot of women were actually trying to do exercise. Was it a very intensive exercise? No, it was kind of walking around the house, but that gave them a lot of confidence, and it definitely was one of the most important mechanisms that they were using. And they also pointed to counseling being extremely important. So going along with that, I just wanted to present some of the programs that Peace and Love and Breast Care International currently does. Among those, our staple program is the Breast Care International Outreach Program, where we go into the communities all over, travel throughout Ghana, get on the bus, and we just go 4 o'clock in the morning, 3 o'clock in the morning, and we go do breast cancer screenings we do clinical breast examinations with trained nurses right after giving a breast cancer education. Another program that we have is the community breast health workshops, where we have mainly women leaders in the community come to the hospital and get trained on breast diseases and breast cancer especially. So last one that we did, we had the Presbyterian Ministers' Wives Association come and learn about breast cancer and breast diseases and how to recognize the signs and symptoms. We also had a workshop for workforce development for nurses in oncology, so that they will be able to also recognize the signs and symptoms of breast cancer as well. So the purpose of these programs are to increase awareness and ability to recognize cancer signs and symptoms, increase awareness of available resources. As I mentioned, navigating the healthcare system in Ghana is a difficulty for many women. So the other two aspects which are extremely important is dealing with myths and misconceptions for certain women. I had a breast cancer patient who actually didn't go for radiation because she thought the price was this price and she didn't feel like she could afford it, and she never actually spoke to anyone, and maybe it wasn't communicated with her the actual price. So she delayed treatment for because of this, and this was a misconception because the price was actually lower and she could have afforded it. And another major point is to reduce the social stigma, and the overall objective is to hopefully downstage cancers. Right now, about 60 to 70% of our cases are in the late stages, in stage 3 and stage 4. So one of our mottos is early stage detection, and treatment is equal to prevention. Among the other programs, we have counseling services. We also have helping others through personal experiences, which is a peer navigation program where we have survivors contact newly diagnosed patients and guide them through their breast cancer journey. We have the Peace and Love Survivors Association, also which has all the Survivors Association network, and also provide public education. And for the future work, we're hoping to expand our youth engagement. So the organization is expanding activities in schools and universities in order to have the youth become breast cancer ambassadors. We are also expanding our screening of NCDs to include hypertension, diabetes, cervical and prostate cancer. We also want to introduce nurses into our HOPE program, so to have them as peer navigators so women can receive advice in the comfort of their home. And we're also hoping to expand our outreach programs to our neighboring countries, so Togo, Benin, Burkina Faso, Ivory Coast, and Nigeria. So thank you very much for this opportunity to be able to speak with you all. I'll be sitting next to my poster at lunchtime. If you would like to collaborate, or if you have any questions, please feel free to come and speak with me. Thank you.